We're in a pandemic. It's called COVID-19 officially, or the coronavirus. Whatever you believe about it, obviously a lot of that has been disrupted by Donald Trump himself, with Bob Woodward's book coming out and the audio tapes he's released. But, in this pandemic, you've got to wonder how many people are going bankrupt because they got COVID, they went to the hospital, they might have been on a ventilator, they might have been on breathing tubes, they might have stayed at the hospital for a long time. And, you got to think, how many millions of dollars in debt are added now that COVID has been a big thing, right? Well, you've also got to ask another question. I mean, how many people do we have unemployed right now? About 47 million Americans. 40 to 47 million Americans. 40 million to 47 million. And, most of those Americans, if not all, had their health care tied to their job. And they lost their jobs, so therefore they don't have health care. Well, God forbid they get sick under the current healthcare system. Well, the biggest issue you have is now they're actually going to go into bankruptcy. Why? Because in this country, our private health insurance companies are very much the rulers of whether you die or you live. Isn't that crazy? You get to live or die based on how much is in your pocket. You go to the doctor's office. They say, oh my God, we think you've got an illness and we're ready to diagnose you. Oh, but hey, do you have $750 right now? No. And then they bring you credit card and different loans you could possibly borrow, right? And you're thinking, do I want to live? How much would I pay to be alive? And the answer is probably thousands of dollars. You'd pay $100, you'd pay $500, you'd pay $1,000. You would go bankrupt to stay alive. And you would think to yourself, well, yeah, I want to stay alive. That's something I'd like to do. I probably have kids I want to walk down the aisle. I've got, grandkids I want to meet. Or maybe you're a young one. Maybe you are like, I want to go to college. I want to start my life. I want to start a business. Right? So now you got to pull out loans and credit card debt because, obviously you need to fight for your health. And what about if you are a person that, maybe you hate your job, but it does give you pretty good health care, and not always all the time. Depending on your seniority in a job, you could have really, really great health care if you're a principal of high school, you're the superintendent, you are, the chief financial officer or the chief marketing officer of a company, and, you might have outstanding health care. You might be a manager and you've got great health care. Whereas if you're the 9-to-5 secretary, you're just filing paperwork all day. You might not have the best health care out of everyone in the workplace that you're at, right? And you're thinking, you know what? I got a friend. They want to start a business with me. I want to go start a business. I want to go back to school. I got pregnant, so I want to stay home and take care of my kids. And I'm just going to quit my job. Well, you can't do that, because if you do that, you'll lose your health care. And you really start to wonder, wow, it's crazy. I can lose my health care because I want to start a business. I can lose my health care because I want to be on maternity leave. I can lose my health care. I'm sorry. I can lose my health care because I want to start a business. I can lose my health care because I want to go to another job. I want to go on maternity leave. I want to go back to school. I want to move cities. I don't know what it is, but you could lose your health care. And then, you get a health care plan and, you find out you got a $10,000 to $20,000 deductible. So now you probably won't even benefit from that health care because you got to pay that $10,000 to $20,000 deductible. And if you're making $20,000 a year in net income, well, ain't no way you're just going to be able to pay off a $10,000 deductible. Who are you? Like, how can you ask someone who only makes $20,000 a year, yes, hi, can you please pay your $10,000 deductible, please? $20,000? And then you've got the pharmaceutical industries, Johnson & Johnson and others, the people who make Truvada, Tylenol, all of those, and insulin. And they're selling you insulin for $336, medicine for $700, another kind of medication for $1,000. And now if you're an elderly citizen, a grandma or a grandpa, you have to decide, do I pay my rent or do I buy medicine? Do I feed my kids or do I buy medicine? Do I ration my medicine and possibly die? Or do I just take it all and then possibly not have the money to buy it next month? Those are all the questions you got to ask yourself. So first you go into medical debt. Then you can't leave your job. Then you can't, you can't get cheap medicine. Then you can't pay off your deductible. And then let's say you need a specialist. You have seizures. You have whatever. And let's just say you have this really amazing specialist, the best in town, the best of the best. You can't get anything better. But, oh my God, he's not in your network, because in our healthcare system, we've got networks that you have to apply for, that you've got to be within, and that doctor has to be covered within that network. So not only do you have to worry, am I going to get better? You got to worry, oh my God, who's this specialist? Are they covered? This and that. And now in a pandemic, after 28 million people don't have health care, 20 million more people lost their jobs, 20 million more people lost their health care. And Joe Biden still says we don't need Medicare for all. He's been asked billions of times, millions and millions of times by reporters, hey man, the country's falling apart. Do you still stand against Medicare for all? Yeah. What if it comes to your desk? It won't even come to my desk, which means I'll make sure the Congress doesn't even pass it, because we're all some corrupt a-holes. That's who we are. We're corrupt. So we're not going to pass Medicare for all. We're going to pass a public option. And then Democratic strategists come out and say, we're not even going to pass a public option. Are you kidding? And so Joe Biden still thinks that the old system that we have now actually helps you. It's actually a good system. So 28 million people off of healthcare. Another 20 million people losing their jobs. They lost their jobs. They lost their health care. And he says, you know what? I like the system we have right now. That's his commentary. He says, I know you all lost your health care. I know 68,000 people die because they don't have health care. I know 500,000 people a year go bankrupt because of medical debt. I know the pharmaceutical companies aren't allowed to negotiate with Medicare and the United States government, and they can price gouge you. While in Canada they're charging like $36 for insulin instead of $336 here in the United States. That's a good system. That's a brilliant system. Die because you don't have health care. Go bankrupt for my mafia middlemen. That's what they are. They're a mafia middlemen. They're mafia middlemen. The middleman is what you call them. Mafia middlemen. That's what Joe Biden is saying to you. And then you get a bunch of dummies in the Democratic Party, centrist Democratic thinkers who are spoon-fed a bunch of bull from MSNBC. And they say, we can't do Medicare for all because we're going to upset the moderates in the party and the Republicans. The moderates are going to vote for you. You need to stop alienating your base, the left. Oh, it's only 30%. Yeah? And what happened when that 30% didn't vote for you? Huh? Oh, we got an orange clown in the White House? He still doesn't agree with Medicare for all. How are we going to pay for it? Oh, I'm worried about the budget. No, I don't think we need health care because he's bought. He's bought by the insurance companies, by the pharmaceutical companies, by Wall Street, by the bankers, everybody. Joe Biden is bought. And if you think he's actually going to give you health care, oh, he's going to leave health care so I don't die. Yeah? And guess what? He's going to put back the individual mandate that said that if you don't buy our healthcare system, if you don't get into medical debt, if you don't pay off a $10,000 deductible on one of our expensive-ass insurance plans, we're going to charge you $695 or something like that. Every single year, the IRS is going to impose that every year you don't have healthcare. Every year. Oh, it's okay for me to charge you $690 every year in taxes because you don't have health care. But it's not okay for me to do a public-funded Medicare for all single-payer system. Under a single-payer system, there is no such thing as networking. There is no such thing as does this doctor have coverage or not. You'd have health care no matter where you are. You could go from Louisiana to Mississippi, from Las Vegas to Connecticut, and you would still have health care. You could leave your job, you'd still have health care. Start a business, you'd still have health care. Go get your education, you'd still have health care. Be a stay-at-home mom so you can take care of your 1-month-old baby. You'd still have health care. Oh, you need insulin? Guess what? We could cap prescription drug I always say prescription drug prices at $200 a year. You don't have to pay $300 for insulin every single goddamn month. You don't have to pay off a $10,000, $20,000 deductible. You don't have 500,000 people going bankrupt over medical debt. You don't have 68,000 people dying because they don't have health care. You don't have to go to the welfare office and sit there for 2 freaking hours signing up a bunch of weird-ass questions that you don't even know what they mean, all because someone wants to price gouge you and not give you a health care plan. Do you have straight Medicaid or do you have Silver Summer? It doesn't matter! You wouldn't have to deal with any of that. Zero, zip. And yet Joe Biden, in a time of a pandemic, says, I like our system. I really do. You know, I really enjoy our system. I think our system is the best in the world. And you know what? We're going to keep it that way. Because it's too expensive. Don't vote for Joe Biden. I'm serious. Do not vote for Joe Biden. Don't even vote for Donald Trump. Show the establishment that when they put up such a terrible candidate who's bought by the insurance industry and Wall Street, you're gonna lose because you're not here for the middle class.